You had a few more things to take care of before North Carolina's stay-at-home order. Your time is now up. That order is in effect.
It comes as the case count continues to rise across North Carolina. Take a look at this map here. There are now more than 1,300 cases and 7 deaths. The state is now reporting 382 cases in Mecklenburg County, the highest for any county in North Carolina. Cabarrus County is up to 40 cases. Now, we want to give you a little bit more perspective here. Take a look here. So let's look at this in terms of population. Mecklenburg County is big. Now, it's home to more than 1 million people. And right now, our rate of cases is about 3.4 for every 10,000 people. Cabarrus County has around 216,000 people. And right now, the rate of cases is a little under 2 per 10,000 cases. Other counties' rates are similar to Cabarrus or lower. South Carolina just announced 2 new deaths in the last hour. It brings the state's total to 18 statewide. There are now 925 cases. North Carolina's stay-at-home order takes effect today, right now, and extends beyond the other local county level orders that are already in effect. It runs up until April 29th. And if you're unsure which order to follow, the governor says stick with the more restrictive measures.
And now one of the biggest questions about this whole stay-at-home order is how is it actually being enforced? County leaders made it clear over the weekend they were not happy with the number of people out at parks, greenways, even sandbars on the lake. Channel 9's Mark Becker asked police and park rangers what they're doing about it. Mark.
Yeah, and Susanna, those concerns, as you say, focused on greenways like Little Sugar Creek Greenway here, where there have been a steady stream of people all day, and where we're told we can be for health reasons and otherwise. But over the weekend, there was a concern that maybe it was too much of a good thing. With 2 toddlers in tow, Meredith Quarles headed for Freedom Park this morning.
Yes, just for a walk, staying very distant.
Splashed with sun, it was a perfect day to go to the park, even if it meant keeping your distance.
We feel comfortable out. We try to stay our distance away.
Yes.
But from everybody.
But over the weekend, we saw where crowds had filled this park, bringing a stern warning from Mecklenburg County's health director about social distancing and questions about just who's enforcing the stay-at-home order. Today, we saw a police officer slowly cruising through the parking lot there. CMPD tells us they got about 300 calls over the weekend about possible violations and actually checked out about a dozen complaints, but haven't had to write any citations or make any arrests yet. Park rangers are keeping an eye on the parks and greenways, but after a busy weekend, we found most people policing themselves.
Right now, a lot of people is like apart from one another, and there's not a lot of people out here.
No one had to tell Deidre and Chaz Howard to keep their distance. And they don't have a problem if police have to tell others to do it.
Should they be writing tickets if folks get too close?
Yeah, because I think everybody needs to be protected, and it just seems selfish if you come up to people and you don't know you have the virus, but you do.
Well, now that's the kind of attitude we found out in the parks today, and most people, again, behaving themselves, but we didn't see the kinds of crowds that were out here on the weekend. And the county says if we don't get it right next weekend, or maybe even later this week, they'll decide possibly they could close the parks. Not in the cards yet, but it could happen, Susanna.
All right, Mark, definitely something important to remember. We'll check back in with you again at 6.
And if you think 4 weeks is a long time to have to stay in your home, listen to what's going on in nearby Virginia. The governor just ordered a stay-at-home order for his state as well, but his order takes effect immediately and goes until June 10th. It also bans groups of more than 10. Our local counties and the state have tried to clear up which jobs are essential and which aren't. But the lines can get a little blurry for some jobs. And Channel 9 is still getting a lot of calls from workers who have concerns they're still clocking in. Channel 9's Deshaun Brown set out to get a little more clarity.
Well, I've reached out to leaders with the county, corporate leaders, and state leaders as well. And the range of the concerns have come in from the employees themselves to their parents. Now, one place that several people have brought in questions about has been hardware stores like Lowe's at Home Depot. We drove by a Home Depot store today, and the parking lot there was full. We also heard from an anonymous Lowe's employee who said at their store, thousands of people are coming in daily, shoulder to shoulder. To clarify, hardware stores are considered essential per the state because they sell supplies people need to help with the upkeep of their home. Construction projects are also allowed to continue. They are described as an infrastructure need. One project manager we spoke with today told me there has been at least one benefit in the construction industry.
No, but safety-wise, it actually works in my favor just with traffic. It's a much safer environment working in the traffic right now.
And here is some of what we heard from corporate leaders at places like Lowe's and Home Depot. They both described similar measures like placing markers on the floor and also signs throughout the store encouraging customers to maintain a social distance. As for Lowe's, I'm told they will also be adding plexiglass for their cashiers. Back to you in the studio.
We've heard from a lot of you wondering, one, if your job is considered essential, and two, do you have to go to work if you're worried about your health or getting sick? Well, I did some digging and I found out it all depends on where you live. Take a look at this. In Mecklenburg County, anyone with questions can call 704-353-1926. If you need to report an order violation, you can call 311. For Cabarrus County, you can email response@cabarrushealth.org. For Gaston County, call their COVID-19 hotline at 704-862-5303. And we are asking the state for the best phone number for anyone with questions about the North Carolina stay-at-home order. We're going to get that to you as soon as we can. And of course, all of this information and more is on our WSOC app. Now, a lot of how to fight this virus can be found in where it's spreading. And within the last 10 minutes, Mecklenburg County just released new information breaking down where in the county the positive cases are. Channel 9's Joe Bruno has been pushing officials for this information all day long, and Joe joins us now live. Joe.
Well, Susanna, we got this information so recently, we don't even have time to flip it onto the television screen right now to show you. But one thing I want to stress is COVID-19 is everywhere in this community, even if it isn't reflected in this data. All zip codes except for one have a positive case in Mecklenburg County. The only zip code that does not have a case reported right now is 28036. That's up in Davidson. But again, officials are really stressing that COVID-19 is everywhere, and you have to assume that it is everywhere. As far as how the cases are spread out, there are at least 13 zip codes in Mecklenburg County with more than 10 cases. And I'm going through this data with you all right now. Here are some more information that the county just sent to us. About 3 in 4 cases were adults ages 20 to 59 years old. 2 cases were youth that were under 20 years old. Younger adults make up the majority of cases for all racial and ethnic groups except non-Hispanic blacks. About 1 in 5 reported cases overall were hospitalized due to their COVID-19 infection. However, hospitalization rates were higher among adults 60 years plus. In that age group, 1 in 2 people were hospitalized. Now, we also learned about people being released from isolation. About 21% of reported cases have been released from isolation. This is after 72 hours have passed with the resolution of symptoms without the use of fever-inducing medications. Now, one thing to note on that, this is based on 303 cases. So for 21% of those people being released from isolation, that's about 63 or so people being released there. So that gives you an idea about how many people are going through this COVID-19 process and able to rejoin society and make sure that everything is okay here, make sure that they are healed from this virus. But a lot of data to sort through. We're going to make sure we can turn this around for 6 o'clock, but that gives you a snapshot of how things are looking right now in Mecklenburg County, Susanna.
All right, Joe, thank you for that perspective and for continuing to push for that information. We're going to see you again at 6. Well, this pandemic continues to impact more families by the day, and now there has been another blow to more workers, this time many of them local. Macy's announced that it will furlough 130,000 workers due to the pandemic. It had already closed its 775 stores after many states forced non-essential businesses to shut down. It says it's now using only the absolute minimum workforce needed. Affected workers will still get company-funded health care through May. The CEO and board of directors say they will stop receiving their salaries too.
And companies across the Carolinas are doing everything they can to help healthcare workers. Anchor Allison Ladas learned how one Concord company is getting creative to make sure doctors and nurses are protected.
Today I spoke with the owner of Thermal Control Products out of Concord. They work with industrial textiles, and now they're working full steam ahead with General Motors to make parts for ventilators. But that's not all. You can see they have some pretty advanced equipment. They're also using it to help make protective gear our hospital workers so desperately need.
You found a sort of resourceful way to get that material that we may be used to seeing in construction sites. So tell me about that.
Okay, so some of the gowns are made out of a material called Tyvek. It's a PPE material. You cannot acquire any of this material right now. It's extremely tough to get a hold of. Kimberly-Clark makes it, DuPont makes some of these materials, and it's being all allocated to the very high-end and very large producing medical garment suppliers and whatnot. So my contacts over at Combat Medical Systems said, hey, why don't you go over to Lowe's and buy some of the Tyvek sheathing that's used to wrap houses. So I went over and we bought some rolls of Tyvek from Lowe's, and we're actually producing the garments. This is not about, making money right now. This is about buckling down and trying to help.
Well, North Carolina right now has ordered more than $60 million in protective gear and equipment to fight the coronavirus, but so much of it is on back order. And Senator Jeff Jackson said that's why he's using social media to reach local manufacturers to help them navigate through the red tape to work with the state.
The president has called on GM and to start making things, but that's on the federal level. How does that impact North Carolina being able to actually get hands on some of this stuff?
We have no idea, and we hope that those super big manufacturers would be able to produce so much that North Carolina could benefit. But why wait and why hope when we have enormous manufacturing capacity here in the state?
In just a few days, Jackson says they've discovered 43 new leads on companies that could soon make protective gear for medical workers. He wants any interested companies to email him.